campus health system spanning the whole region. We offer healthcare services from newborn neonatal care through end of life and the elderly population. We do have a full children's hospital as well as a children's surgery center, which we just opened in April. We have 140 physician practices, and that is growing. We as a network are growing with 17 community clinics, 11 express cares. So an express care in the U.S. is a combination of a physician practice and an emergency room. So a lower acuity visit does not need to go to the emergency room, and it has extended hours for basic medical conditions and minor emergencies. Lehigh Valley Health Network employs over 13,000 employees, nearly 1,400 physicians, and close to 600 advanced practice clinicians. And that group consists of nurse practitioners, nurse midwives, nurse anesthetists, physician assistants. We have nearly 4,000 registered nurses. We do about 60,000 admissions, inpatient admissions per year in our network. We see nearly 210,000 patients per year in our emergency room. So we are the regional leader in emergency care and have over 1,100 acute care hospital beds. Any questions about the network? And you'll have opportunities throughout the day to ask questions of many different people.
Pregúntale que entonces son comunidades clínicas, 17 comunidades clínicas.
17 community clinics, what are those?
We offer community services in our downtown Allentown area, which is our inner city. So pediatric clinics, women's clinics, you name it. HIV, AIDS clinic, hepatitis. And most of our clinics are focused on providing care for those who can't pay.
¿Con médicos?
Physicians and advanced practice folks.
Y también personas profesionales de prácticas avanzadas.
¿Y qué son health centers?
And what about the health centers?
So health centers are strategically placed around the region, and then we'll have multiple practices in them: physician offices, diagnostic care, laboratories. So little mini hubs.
So como que mini hubs. Also physicians?
Physicians will be there also. Sometimes a shared practice where they drop in certain days, or dedicated practice. Some of our health centers even offer cancer services, so chemotherapy, pharmacies, things like that.
Express care. Tell us more about the express care locations.
Yeah. So they're strategically placed around the region. So since we only have 5 inpatient campuses, many of the health centers have express cares either near them or on their campus. And so you can provide lower acuity emergency services. Someone has a cut, fracture, dislocation, someone doesn't feel well, and their physician practice is not open, they go to the express care. And Dr. Whalen, who's speaking next, will talk about the changing environment and probably highlight some of the needs for express care in the United States.
Pregúntale por qué diferencia 140 physician practice de 1,340 physicians. ¿Cuál es la diferencia?
What is the difference between 140 physician practices and 1,400 physicians? What do you make that difference between the physician practice?
So the practice could have multiple physicians in the practice.
Puede tener varios médicos dentro del consultorio.
So consultorios.
Physician practices son consultorios, son como doctor's offices.
So our health network has a subsidiary called Lehigh Valley Physician Group. So they are employed through the network, and we have 140 practices. It can be anywhere from a surgical practice, a medical practice, a pediatric practice. and it employs multiple physicians within that practice.
médicos dentro de ese consultorio grande.
Physician practice.
So a physician practice is like a doctor's office.
Doctor's office. So
Physician practice
for
es como un consultorio médico as well.
So one of the things that we're really proud of at Lehigh Valley Health Network is we are not only a large health system, we provide great quality care. This is another slide you'll probably see a few times today, because most folks who work here are extremely proud of the care we provide. So if I look ahead at 2014, 2015, and we extended that into 2016, a lot of these awards were won in 2015 also. We're ranked as one of the best hospitals and health systems in the United States. Each year, between 8 to 10 specialties, we're ranked there in the top 100 hospitals in the United States. Some of the other things that we take great pride in is our ability to offer advanced technologies in our information systems. And Dr. Don Levitt, who's our Chief Information Officer, will be here today and talk about technology and how that we provide care with technology. We have a large cardiac surgery program here, offering just about every advanced technology outside of heart transplant we do not offer. We're the regional leader in aortic surgery, as well as minimally invasive techniques to implant aortic valves. So we now implant aortic valves without making an incision in the chest. We go through the groin, and it's a catheter-based procedure. And we're a fully accredited regional stroke center also. Our agenda for today, like I said, it's a very exciting agenda for me. We have Dr. Tom Whalen, who's our Executive Vice President for the network, as well as our Chief Medical Officer. He's going to talk about the changing landscape of healthcare in the United States. And then Dr. Don Levitt, who speaks each year about our electronic health record. And we'll highlight on some of our recent implementation of an electronic medical record here at Lehigh Valley Health Network. Following that, we'll have a break and lunch. And then we'll do some tours through the network. You'll see 7K, which is our orthopedic surgical floor. So our total joint replacements and some of our spine surgeries will go to that floor post-operatively. As I highlighted before, our emergency department is quite large, quite busy. You'll get an opportunity to see that. Our open heart unit and transitional open heart unit is where our heart surgical patients go immediately post-op and throughout their stay before discharge. A highlight of each year's tour is the Surgery Ed Center, where we train medical students and residents in certain technologies, and you'll be able to see that firsthand. And also a tour through the pharmacy. And you'll be able to listen to talk about our pharmacy robot that fills prescriptions. Any questions? So we're waiting on Dr. Whalen now. He was just in a meeting and should be on his way any moment.
Is it he or she?
He, Dr. Tom Whalen. And Dr. Whalen can, answer about any question you have about U.S. healthcare right now.